A concussion is a brain injury. It's more than just a bump on the head. Concussions happen when the brain is jolted inside the skull. This can be from a direct blow to the head. It can also happen from a whiplash-type injury. Concussions temporarily disrupt brain function. This disruption can cause a variety of symptoms. These symptoms can be physical, mental, or emotional. Most concussions resolve with proper care. However, some can have lasting effects. It's important to remember that every concussion is unique. The severity and symptoms can vary widely. Understanding the seriousness of concussions is crucial. This understanding promotes awareness and appropriate management. This can prevent further injury and long-term consequences. Seeking immediate medical attention after a suspected concussion is vital. Early diagnosis and proper care are essential for a full recovery. Remember, it's always better to err on the side of caution when it comes to brain health. The impact zone, how concussions happen. Concussions are often associated with sports. However, they can happen in many other ways. Falls are a leading cause of concussions, especially in young children and older adults. Car accidents, even minor ones, can also result in concussions. Any activity that has a risk of head injury can lead to a concussion. This includes cycling, skateboarding, and even playground activities. In any situation where a blow to the head or sudden jarring force occurs, a concussion is possible. The brain is cushioned by fluid inside the skull. However, a strong enough impact can cause the brain to hit the inside of the skull. This impact can damage brain cells and disrupt normal brain function, leading to a concussion. It's important to note that concussions don't always involve losing consciousness. In fact, most people who sustain a concussion do not black out. This is why it's so important to recognize the other symptoms of a concussion. Recognizing the signs. Common concussion symptoms. Concussion symptoms can be subtle and may not appear immediately. Some symptoms may appear within minutes of the injury. Others might not surface for hours or even days. Knowing what to look for is crucial for early recognition and treatment. Common physical symptoms include headaches, dizziness, and nausea. A person may also experience blurred vision, sensitivity to light or noise, and balance problems. Feeling sluggish or fatigued is also common after a concussion. Cognitive symptoms involve thinking and memory. A person may have difficulty concentrating or remembering new information. They might feel confused or foggy in their thinking. Slowed reaction time is another common cognitive symptom. Emotional changes can also accompany a concussion. A person may feel irritable, sad, or anxious. They may also experience increased emotional sensitivity or have difficulty controlling their emotions. Section 4. Assessing the invisible injury SCAT-5 and ACE. Assessing a concussion involves a combination of physical examination and cognitive testing. The SCAT-5, or Sport Concussion Assessment Tool 5, and ACE, which stands for Acute Concussion Evaluation, are two commonly used tools. These tools help healthcare providers evaluate the severity of a concussion. The SCAT-5 is a standardized tool used by healthcare professionals. It assesses various aspects of concussion symptoms, including memory, balance, and coordination. It also helps track the recovery progress over time. The ACE is similar to the SCAT-5, but is specifically designed for use by athletic trainers and other sports medicine professionals. It includes a symptom checklist, cognitive assessment, and balance testing. These tools are valuable aids in concussion assessment. However, they are not meant to be used for self-diagnosis. If you suspect a concussion, it's crucial to seek immediate medical attention. Section 5. When to see a doctor. Medical evaluation is key. Every suspected concussion warrants a medical evaluation. Even if symptoms seem minor, it's essential to have a healthcare professional assess the injury. Early diagnosis and proper management are crucial for preventing long-term consequences. A medical evaluation typically involves a physical examination. The doctor will check for signs of trauma and assess neurological function. They will also ask about the specific details of the injury. This helps them understand the mechanism and potential severity. The doctor may order additional tests such as a CT scan or MRI if they suspect a more serious injury. These imaging tests can help rule out bleeding in the brain or other structural damage. Remember, you are your best advocate for your health. If you have any concerns following a head injury, don't hesitate to seek medical attention. Section 6. Beyond the surface. Neuroimaging and concussions. Neuroimaging, such as CT scans and MRIs, plays a role in concussion management. These tools help visualize the brain and detect any structural abnormalities. However, it's important to note that concussions are primarily functional injuries. This means they don't always show up on standard imaging tests. CT scans use X-rays to create detailed images of the brain. They are particularly useful in detecting skull fractures or bleeding in the brain. These conditions require immediate medical attention. MRIs use magnetic fields and radio waves to create images of the brain. They provide more detailed views of brain tissue. MRIs can sometimes detect subtle changes in the brain after a concussion. These changes may not be visible on a CT scan. While neuroimaging can be helpful in certain situations, it's not always necessary for diagnosing a concussion. The decision to order imaging tests depends on the severity of symptoms and the doctor's clinical judgment. Please subscribe to Dr. GT channel for more health tips.